Welcome to our Collect, Review, Do guidance. 3 videos developed to support you in using service user feedback to make the improvements that matter most. This first video walks you through the key elements of feedback collection and summarises how you can get involved. Firstly, you will need to consider which method of feedback collection is most appropriate for your service and service users. What your team uses will depend very much on your own circumstance, and one size certainly doesn't fit all. You will therefore come across a number of options here at Elft. All teams are able to collect service user feedback via an online survey which can be found on the Your Feedback Matters page on the Elft website. You can encourage service users to leave feedback in this way by including reminders in correspondence, adding QR codes to leaflets, or setting up text message reminder systems. Some teams also provide a similar method of feedback via floor stands, taking advantage of communal areas which service users may pass through frequently. This makes providing feedback more visible and accessible to those who are in contact with our services. Another similar feedback option is our tablet survey. This is the added benefit of allowing staff to be more involved in the collection process, enabling them to offer support to those who may need it and collect feedback in real time when it is most relevant. These can also be used when you're not at an Elft location, and the data will upload when you next reach a Wi-Fi network. While each of these options are appealing, as they take advantage of our digital systems and technology, sometimes pen and paper is still the best option. This is still available, and teams are able to use paper surveys that are then manually input into our system. Teams will differ in how frequently they collect feedback. You should offer all inpatient service users the opportunity to leave feedback once before they are discharged. However, if someone is in contact with your team once every few months, you might wish to ask them each time you see them. The general rule is, the more feedback we collect, the more useful it is. However, we also need to ensure service users don't experience feedback fatigue. As caring professionals, we have a lot of experience in finding the right time to approach people and starting conversations. These same skills apply when offering people the chance to give feedback. Therefore, think about who is going to offer the survey to service users and carers. The service user may wish to complete the survey on their own, or they may need a bit of assistance. Check in with them if they would like help, who they might like it from, and be aware that they may need a translator to assist them. Be honest with the service users about how long a survey may take to complete. And always make sure they are aware that they can choose to stop the survey at any time if they feel uncomfortable with the questions they are being asked. Remember, there is always the option to complete the survey at home if they will feel more comfortable doing this. Encourage service users to leave comments. This can give us really helpful insight so that we can better understand how and what to improve. Make sure you remind service users that comments won't be linked back to them and all feedback remains anonymous. Remember, if the service user has a particular complaint, compliment, or they want to speak to someone about their care, the survey is not the right forum for this. Direct them to the Trust's complaints and compliments process. Well, that's our roundup of how and why we collect service user feedback here at Elft. Tune into our next video to get a better understanding of how to turn the data we get from our surveys into a useful tool for improvement.